The peer support centers are part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. La Voz Latino Wellness Center program has a unique way to effectively increase access and promote mental health services in the Latino community. The program is formally and informally engaging the Latino community as part of the workforce. The program's main goal is to provide outreach to link people to services, information, and mental health support. To this end, La Voz has developed ways to engage the Latino community in Lake County. The following implementation methods are being used: Latino stakeholder meetings, facilitating Latino support group, meeting them over coffee, food and talk. The Latino O&E program also have to deal with gaps in our health and social services system when attempting to link people to services. Finding services that have the necessary linguistic and cultural capacity is often difficult. La Voz Latino Wellness Center program is mainly serving the underserved Latino community in Lake County. The program is particularly effective in reaching Latinos and other underserved families and individuals. In addition, the program can help address multiple barriers to accessing services, such as those related to culture, language, stigma, and mistrust. The following strategies are being used to address mental health stigma among the Latino community. 1. Presence in the community. Engaging the Latino community by educating them on the various programs provided by Lake County Behavioral Health Services. 2. Persistence. Promoting mental health services to the Latino community by providing resources and assistance in their own language. This will increase comfort levels and confidence in using mental health services. 3. Patience. Implementing strategies to deter stigma of mental health in the Hispanic community with different titles. The Latino O&E program is making a big difference by addressing access barriers that arise from cultural and linguistic differences, stigma, and mistrust of the system. La Voz Latino Wellness Center is an important part of service delivery, especially useful in engaging people who may have barriers to accessing care, such as individuals who are experiencing homelessness, were formerly incarcerated, members of minority communities, or youth and young adults. The key to effective outreach is taking the time to develop relationships with individuals and start where they are. This requires listening and interaction skills, patience, and a willingness to be flexible. While there is no set formula, it is essential to meet individuals where they are. This means that staff allow them to make changes when they are ready and not simply offer solutions. Staff takes whatever time needed in order to build rapport, trust, and hope. Staff know that providing supports and resources have an impact and can help move people toward greater stability over time. Due to a high number of peers utilizing services, staff are continually updating the outreach log and entering all numbers into the Wellness Recovery Center reporting tool. La Voz de la Esperanza serves anyone in the community who may be suffering from mental illness, substance use, and/or homelessness. Center staff attends internal case management meetings with the Access Team, Crisis Team, and Treatment Team to link community members to treatment services. Staff work with the LCBHS Housing Coordinator to identify housing needs of consumers and attend direct care meetings, housing navigator meetings, and provide outreach services to local housing shelters. Staff educate peers on available services and how to schedule appointments. If needed, staff assist in scheduling assessments and appointments while also being available to provide transportation. La Voz de la Esperanza served a total of 1,746 individuals in fiscal year 2021. Of those 1,746 served, 90 were children 0 to 15 years of age, 24 were transitional age youth 16 to 25 years of age, 1,170 were adults 26 to 59 years of age, 12 were over age 60, and 450 did not report their age. La Voz de la Esperanza served a total of 1,746 individuals in fiscal year 2021. Of those 1,746 served, 18 identified as other Pacific Islander, 102 identified as white, 1,488 identified as Mexican American, 204 identified as not Hispanic, and 1,488 identified as Hispanic or Latino. La Voz de la Esperanza served a total of 1,746 individuals in fiscal year 2021. Of those 1,746 served, 1,152 were born female, 354 were born male, 450 did not report their birth gender, 1,152 identified as female, 354 identified as male, and 450 did not report their current gender identity. La Voz Latino Wellness Center program has identified several social and emotional challenges that Latinos face in Lake County. These are some challenges: problems with housing, difficulties at work, exposure to violence or domestic violence, problems with immigration, lack of health insurance, linguistic barriers, alcohol and substance abuse. The way that La Voz program is addressing these issues in the Latino community is the following: navigating the system, finding available resources, support groups in Spanish, finding barriers to services and increasing access, Platicas y Comida, increases trust in the community, community involvement. One of the most important characteristics of the Latino Outreach and Engagement Program is to come from the community we serve. We can address access barriers that arise from cultural and linguistic differences, stigma, and mistrust of the system. Latino Wellness Center has become one of the most influential programs in Lake County. The program is continually receiving mental health referrals from beacon providers such as Lakeside Clinic, Adventist Health, Lake County Family Resource Center, Lower Lake High School, Kelseyville High School, Pomo Elementary, Lower Lake Elementary, and Clear Lake High School. Our program is continuously providing support groups and other services to our community. Groups such as Latina Support Group, Latina Mental Health, Alcoholic Anonymous, Children Activities, Youth Support Group, Art for Happiness, and ESL. Also, our center provides mental health brief intakes, behavioral health screenings, SUDS referrals to rehab or detox, client case management, and peer support. Other services include housing referrals to California Human Development, DIGS, domestic violence support and placements, clothes closet, computer access, and food drives every fourth Monday of the month.